Hi friends, today I want to talk about certain factors that can affect your thyroid lab test results. In this short video, I will cover some tips to ensure that you get the most accurate result that you and your doctor can rely on. Okay, let's talk about time of the day. Here's the important thing. Your thyroid fluctuates throughout the day, especially your TSH scores. So this means that your TSH first thing in the morning is not the same even a couple of hours later, and again in the afternoon and into the evening. It can all be different. So this means that you need to test at the same time every time you test to get a consistent result that really reveals what is going on in your thyroid. Now let's talk about medications. Medications are also a big factor. They have an especially large impact on your free hormones, T4 and T3. If you check your free hormones in hours after taking your medication, you could be pretty much anywhere except not at your baseline. So I suggest not taking your thyroid medication right before testing. Now let's talk about supplements. Supplements that contain biotin, probiotics, and a few other things can throw off your thyroid scores. I'm not saying that they hurt your thyroid or they can cause harm. They simply make the test less reliable. That can even be the case days later. So 3 days before your test, stop taking all supplements. This will result in the cleaner findings that you can take actions on. Now let's talk about menstrual cycles. When it comes to women with regular menstrual cycles, there is a compound called TBG, thyroid binding globulin. And how much you make is a function of how much estrogen is in your circulation. If you're a woman with a regular menstrual cycle, the amount of estrogen in circulation is very different during your period than right after ovulation. So, you want to be consistent. The worst time to check is in the middle of your cycle. The best time is the first week, well, roughly, or the very end of the cycle. Those are good times to check. Now let's talk about fasting. Have breakfast in the morning as you normally would, or don't if you normally don't eat. Whether you just had a meal and how your blood sugar is playing out will also affect and change your thyroid scores. So be consistent before you test. Okay, let's recap. Get the blood work done in the morning before you eat or take pills. Skip any supplements 3 days beforehand. And number 3, make sure you're in the right period of your cycle. Okay guys, each of these markers is crucial. So now that you know them, it will help ensure you're always getting consistent and reliable results that you can really understand and rely on. Comment below and let me know if this video was helpful.